Okay, welcome everybody. We're going to start. We're very happy to have Dusty Jessen here today. She's talking about a very important topic, our brains and our hearing. So I'm very excited to hear what she has to say. Also, our captioner, Lindsay, could not come today, and Trish has stepped up for us, and Trish will be doing our captioning. Okay, go ahead, Dusty.
All right, thank you. Thanks everybody for being here this cold and snowy spring day. I'm going to share my screen. Okay, so yes, we are going to be talking about hearing and cognition and just figure out what all the buzz is about. So I am Dusty Jessen and I am an audiologist at Columbine Hearing Care. I'm the owner of the practice, and we are located at Broadway and Dry Creek in Littleton. And I'm also the creator of the 5 Keys Communication Oral Rehabilitation Program. So I'll talk a little bit about that at the end. So our key learnings for today are to understand cognition and cognitive decline, and to understand the connection between cognitive health and hearing health. We're going to get a little technical with this, so hang in there with me. We're going to understand my role as an audiologist in preventing cognitive decline for my patients. And then we're going to talk about cognitive screening and a new tool that allows us to screen cognition and cognitive abilities. And then finally, we'll wrap up with lots of tips and tools that you can use right away to preserve your own cognitive health. So I'd like to start just by thanking a few people. First is Cognivue. So Cognivue is the company who created the cognitive screener that we will be talking about. And they have provided a lot of the slides that I'm going to be showing you. And then I also want to thank my fellow colleagues of mine. Dr. Heidi Hill is an audiologist in Minnesota, and she has really been leading the charge for the audiology community in bringing cognitive health awareness to the providers and making the Cognivue screener readily available to all audiologists so that we can add this valuable resource to our arsenal of treatment or diagnostic and treatment options. And then Dr. Al Turi and Dr. Noel Crosby are both audiologists in Florida who have really implemented a lot of the things that I'm going to be talking about and kind of leading the way, following in Dr. Hill's footsteps to get this out there. So I like to give recognition to my colleagues who are really doing a great job of expanding our profession and helping so many more people in this realm. So this is an interesting graph about the diseases that people are most worried about. And the gist of it is that Alzheimer's disease is the one that people of all ages are most worried about. So we're talking about millennials, Gen X, boomers, all ages are most worried about Alzheimer's disease, and they're more worried about it than they are worried about cancer, stroke, heart disease, diabetes, and arthritis combined. So this obviously is a very important topic to all people. So let's understand it a little bit. What is cognition? Well, cognition is just the mental processes that make us who we are. It is how we deal with information, how we exercise judgment, and how we behave appropriately. Now, cognitive decline, which we're going to talk a lot about, is a reduction in brain function, and it results in difficulty remembering, learning new things, concentrating, and making decisions. And this is what we ultimately want to avoid, right? And then this might be a new term for you, cognitive reserve. This is the brain's ability to cope with or compensate for neuropathology or damage to the brain. And cognitive reserve is developed over a lifetime of education and curiosity. And it really helps our brain to cope with cognitive decline. So cognitive reserve is what we want to build and preserve. A lot of people are curious what the difference is between cognitive impairment, dementia, and Alzheimer's disease. So that's what this slide goes over briefly. Mild cognitive impairment is slight but noticeable and measurable decline in cognitive abilities. And this is mostly seen in memory and thinking skills. Now, dementia is one step further where it impacts more than one cognitive domain, and it creates a substantial interference with daily life. And then one step further is Alzheimer's disease. And this is the most common and severe form of dementia. And it is a progressive disease of the brain. So I have a little quiz for you. I've got 3 quiz questions to see how your cognitive knowledge is. So this is true or false. You don't have to say it out loud. You can just think in your mind what your answer is. True or false? Cognitive decline will always lead to Alzheimer's disease.
False.
And the answer to this is false. The next question, true or false? Cognitive decline always happens as we age. Again, the answer is false. Changes to certain modifiable risk factors at any age can improve our capabilities to process information and preserve our memories. And the final question of your quiz, true or false? Early detection and intervention can prevent, delay, or slow the onset of or progression of cognitive decline. And thankfully, the answer to this is true. And this is why we're here today. Early diagnosis is absolutely critical. The earlier that cognitive decline is found and intervention starts, the better our outcomes. And really, the interventions work best in the pre-symptomatic stages of cognitive decline. So before any symptoms are even available, but it might show up on a cognitive screening tool, that's when lifestyle changes and medical intervention work the best. But there have been a couple of challenges in screening cognition and a widespread screening of cognition. The first challenge is the stigma that goes along with it. So people are just embarrassed by memory loss often or other cognitive issues. And there's a misunderstanding that cognitive decline is inevitable. And there's also a lack of access and awareness for the importance of early screening. And then issues with testing tools are mostly that previously the testing tools for cognitive performance have been paper and pencil testing that can lead to a lot of false positive or false negative results. They can be subjective to the test taker, sometimes inaccurate, and there's a lack of consistency. So anytime we're testing with paper and pencil, there's a lot of variables that have to be taken into play. But 82% of seniors believe that it's important to have their memory checked, and only 16% say that they receive regular cognitive assessments. So there's definitely room for improvement here. So how is hearing health connected to brain health? In other words, why am I, an audiologist, here talking to you about cognitive health? Well, hearing loss plays a role in our ability to stay mentally sharp as we age. And untreated hearing loss can lead to isolation and loneliness. And research has linked hearing loss to an increased risk of cognitive decline, dementia, and Alzheimer's disease. So I'm going to briefly talk about what an audiologist does. And you probably all know this, but just in case this is new to you, my profession, audiologists, are the primary healthcare professionals who evaluate, diagnose, treat, and manage hearing loss and balance disorders in both adults and children. And we work in a variety of settings, including hospitals, clinics, private practice, ENT offices, universities, K through 12 schools, government, military, and the VA hospitals. And just a little public service announcement is that hearing healthcare or healthcare professionals suggest having your hearing checked once per year to monitor changes in your hearing health. So the common tests that audiologists provide, you can see listed here. You've probably undergone audiometry and middle ear function testing. That's called tympanometry, speech testing. Some that are a little bit more rare and used for special cases are electrophysiology testing and otoacoustic emission testing. Perhaps you've gone through hearing aid fitting and speech mapping and real ear measurements. We do that every time we fit hearing aids. And auditory rehabilitation, which actually is my specialty as an audiologist. We do balance testing, and now, more recently, many audiologists are doing cognitive screenings. Many were doing them before in the old paper and pencil method, but now that we've got a better option, it's becoming more widespread, and we'll talk more about that. So there are three fundamental processes that we need to hear well and understand speech. So I like to think of this as ear to brain hearing. We don't just hear with our ears. That's only process number one. That's our peripheral auditory system. Then the second process is our central auditory system. And this is where sound is modified and analyzed. And then the third process is cognition, or the cognitive processes. And this is where the signal is understood and stored. So all three of those have to be working for a message to get from a speaker to the listener effectively. This is kind of a wordy slide, but I want to present this in a couple of different ways to make sure that you understand this. So the link between hearing and cognition goes both ways. So the impact that hearing loss has on cognition is that long-term hearing deprivation can impact cognitive performance because hearing loss places one at a greater risk for cognitive impairment. And there's increasing evidence that links age-related hearing loss to a more rapid progression of cognitive decline and incidental dementia. And then, okay, so then going back to how cognition impacts hearing. So if we have limited cognitive skills due to aging or a head injury, this can reduce the cognitive resources that are available for understanding speech, especially in background noise, and that increases the effects of hearing loss. And age-related hearing loss is associated with increased cognitive load, which we're going to talk about, due to the increased challenge of interpreting a degraded peripheral signal. So another way to look at this, just so that you've got it, is this kind of graph here. So when you have hearing impairment, the inner ears don't capture the complete auditory information for the brain to process. And this can lead to three common causes of cognitive impairment. The first is cognitive load, like I just mentioned. So increased cognitive load happens as the brain is having to work harder to fill in the gaps that the hearing loss created. So this can be in working memory and executive functions. They have to kick in to support the listening. And the long-term effects of this extra cognitive effort can deplete that cognitive reserve that we talked about in the beginning. And then secondly, are changes in brain structure. So when the cochlea is deprived of sound, if we don't have the sound going in, then the brain is also deprived of sound where it used to be processing that sound. And then this can cause a loss in the gray matter of the brain. And finally, hearing loss reduces social engagement as people sometimes withdraw from social activities. And that means that there's less stimulation to the brain. So I kind of think that the best way to understand that how hearing and cognition work together is to experience it yourself. So when we have a degraded auditory signal, it requires our brain, the cognitive processes in our brain to kick in. And this is even when it's a mild cognitive impairment, and it can make communication really difficult. So think about a time when you were in a noisy restaurant, and this could have been pre-COVID, but I know we've all been in noisy restaurants, and especially those ones with hard floors, high ceilings, a lot of reverberation and people talking. And think about how much difficulty you had. And it might have sounded something like this. So even people with normal hearing struggle to communicate in noisy places. And when you add hearing loss to the picture, the brain is having to work extra hard to make up for the poor signal that the auditory system is providing it. It has to tap into working memory and executive functions, and it also has to look for help from other sensory systems like vision and touch. And this can be really stressful and leave you feeling exhausted. All right, isn't it nice when that noise goes away? So just in case you missed it or our transcriptionist missed it, I'm going to say that again. Even people with normal hearing struggle to communicate in noisy places. When you add hearing loss to the picture, the brain is having to work extra hard to make up for the poor signal that the auditory system is providing it. It has to tap into working memory and executive functions, and also has to look for help from other sensory systems like vision and touch. And this can be really stressful and leave you feeling exhausted. I would bet that if I left that background noise on for the rest of my presentation, many, if not all of you, would eventually have had enough and clicked that little red button on your screen that says leave meeting. And this is exactly why those with untreated hearing loss or improperly treated hearing loss, and even in those with mild cognitive impairment, often isolate themselves, which just further perpetuates the cognitive decline. And so this is exactly why it's so important to screen for cognition early and to take appropriate measures to reduce further decline. Okay, so the reason it's so important for me as an audiologist to understand my patients' cognitive abilities is because it helps me do two things. It helps me make appropriate referrals, and it helps me to create a personalized treatment plan for them. So referrals might be made back to the primary care physician, the geriatrician, a neurologist, a geriatric psychiatrist, a psychologist, or a counselor, depending on what the results show in my testing. And then when I'm going about creating a personalized treatment plan for my patients, this is when I have to choose a correct hearing aid and set the prescription for the hearing aid appropriately for that person. And their cognition comes into play as I'm making those decisions. It also helps me know if I need to include assistive listening devices in their treatment plan and what kind of environmental modifications I need to teach them to make, what kind of listening strategies need to be educated about, and how involved the family members might need to be in the treatment, and also if it's an appropriate person to undergo an auditory brain training program. So this is all critical information for my decision-making process as I'm helping my patients to cope with hearing loss and possibly the mild or moderate cognitive decline that might be going along with it. So hearing intervention has a huge effect on cognitive performance, and this is the results of a landmark publication in The Lancet that showed that hearing impairment was the #1 modifiable risk factor for cognitive decline when it was identified and addressed in midlife. And notice that it's not when it's addressed in later life, because sometimes it can be too late. That's why we want to be doing these cognitive screenings early. And a growing number of research studies are finding a direct correlation between hearing intervention and the arrest and potential reversal of cognitive decline. So the Journal of the American Geriatric Society says that providing hearing aids or other rehabilitative services for hearing impairment much earlier in the course of hearing impairment may stem the worldwide rise of dementia. So you can see how important this is. So now we're going to talk about cognitive screening and this tool that I've been mentioning. So the Cognivue is this device that you see on your screen, and it is a standalone computer. And we're going to watch a little video that kind of explains it in better detail. So I'm going to start that now.
Welcome to Cognivue. This is a screening to measure your cognitive performance. Cognitive performance is how your brain performs. Like your cardiovascular health or other important functions of your body, brain health should be a part of your routine health checkup. You may think brain health decline is only connected to dementia or Alzheimer's disease, but that's not true. It can be related to a number of risk factors like diabetes, hearing or vision issues, medication side effects, or even lack of sleep. Early detection and risk reduction of cognitive decline is quickly becoming top of mind within the healthcare community. Recent research efforts have helped us learn much more about the importance of brain health and its relationship to your overall general health. Monitoring your cognitive performance, making good wellness choices, and partnering with your healthcare provider is a winning combination for managing your brain health. This is the Cognivue, and it is your only interaction with the screening. To get comfortable with the Cognivue, go ahead and try it right now. Rotate it left, and then right. It's not an IQ test or a series of questions and answers. It's a series of different exercises. Before each exercise, you will be provided with 2 practice sessions before you take the measured exercise. Motor skills. In this exercise, we will be capturing your current motor abilities, which differ from person to person. The exercise requires you, to the best of your ability, attempt to keep the green wedge on the moving white dots. Visual acuity. This exercise uses the same green wedge, but this time you're being measured on your ability to track the moving white dots as they become more faint. Word perception. This exercise uses common 3-letter words within the English language. You are challenged to find the real word among non-word symbols. In this shape perception exercise, you are asked to find a shape that is different than the other shapes. These are not normal shapes you would expect. Rather, they're visual cues to help us measure your ability to perceive which shape is different than the other. Word memory. In this exercise, we use the 30 most common 3-letter words in the English language. A word will be placed in the center, followed by other words. You will be asked to remember and select the first word shown. This exercise will be extra challenging if you don't follow the instructions. The instructions will ask you to remember and identify the word that appears in the middle first. Select the correct word as quickly as possible. Shape memory. In this exercise, you are challenged to remember shapes that are unique. These are not normal shapes that you would expect. A shape will be placed in the center, followed by other shapes. You will be asked to remember, identify, and select the first shape shown. Let's review again some important recommendations. Eliminate distractions like your cell phone. Keep friends and family at a distance as you do the exercises. Stay focused on each exercise. If you wear vision correction, please use them before the exercise begins. Use your dominant hand, which is usually the hand you write with. It is very important you read all instructions carefully. Stay calm under pressure. Each exercise will get progressively more difficult. Select the right answer as quickly as possible. If you remember to follow these suggestions, it will help us get the best measurement of your current cognitive performance. Once the screening is complete, you will receive a personalized one-page report from a cognitive performance representative.
And then the screening is a 5-minute screening evaluation, and there are 6 tests that you take. So the first 2 are adaptive motor control and visual salience testing. And these are part of this program's adaptive psychophysics, which basically gets a baseline for that specific person about how well they can, about their motor ability and how well they can see, so that the remaining 4 tests are then calibrated accordingly so that it's all, it's fair, I guess you would say, if someone doesn't have as fast a motor control or if their vision is a little bit impaired, those tests will be modified with a slower time and bigger dots and bigger visuals. So all this calibration eliminates the bias and the human error that can happen with paper and pencil tests. So the word perception testing happens the perception testing happens with words and shapes, and the memory testing happens also with words and shapes. So it's kind of a weird test, but an interesting one to take. I've taken it a few times myself, and it's good information to have. And again, it's not trying to diagnose any kind of impairment. It's just basically showing what our performance is, our cognitive performance, just like if we did another test to see if we did a running, did a running race to see what our running performance would be. And then at the end, you are given a report that's called the Thrive Report, and it shows you your score within each of those domains. So the cognitive domains of memory, visual, spatial, and executive function, and the performance parameters of reaction time and processing speed. And so as you can see, there's 3 possible outcomes, but it's a range. So if you fall into the green, that's normal cognitive performance. And the yellow is mild cognitive performance or ability. And the red is moderate to high cognitive loss. So it's a good report to have that can be shared with your physician and your audiologist or anyone else that might help you be making choices about your cognitive health. And then they also give you a sheet that's called the Cognivue program. And so now we're going to get into the things that we can all do at any age to preserve our cognitive reserve and make keep ourselves healthy cognitively. So I'm going to take you through each of these. The first is to control our medical risks. So taking control of any underlying medical conditions will help us reduce our risk for memory loss and cognitive decline. Examples of these conditions include diabetes, high blood pressure, high cholesterol, smoking, and excessive alcohol consumption. So it is important to see your physician regularly and follow the medical recommendations. The second one is to exercise regularly. So exercising elevates our heart rate and increases the blood flow to our brain, which helps to reduce the risk of memory loss and cognitive decline. The recommendation is 150 minutes per week of physical activity. So that's just 30 minutes per day, 5 days per week. Next is the importance of staying mentally fit. So we want to continuously challenge our minds because this stimulates our brains and helps protect against rapid memory loss. We want to have fun engaging our brains by reading books, playing games, doing puzzles, and really just being a lifelong learner and continuously challenging our minds to stay cognitively fit. Maintaining social connections. So staying connected and leading an active social life is really important to our cognitive health. Spending time with our family and friends, talking and laughing together, and just being active in general helps our memories and our brain health. Sleep and relaxation are also very important. So sleeping at least 6 to 8 hours each night can help our memories and brain health. And it's important that we see our physician if snoring interrupts our sleep or if we don't wake up feeling rested. And we really need to listen to our bodies, rest when needed, and find ways to manage our stress. Finally, eating healthy. So a well-balanced diet that's low in fat and high in antioxidants can help reduce our risk of dementia and help maintain our memories. You can talk to a nutritionist and your physician to find a diet that's right for you. It's important to understand how vitamins, brain health supplements, and other nutrients might impact the medications that you take as well. So next, and this is actually the final part of the presentation, I think we're going to end a little bit early here, is I'm going to provide you with several tools to that you can use if you want, that are geared toward keeping our brains and our auditory systems sharp. And the first tool is actually the Cognivue. The Cognivue screening is something that can be taken before you do any kind of intervention and then after you do the intervention, because it's a nice tool that lets you compare the before and after and see if it was useful. I have this Cognivue at my office, and I only charge $45 for the cognitive screening. You're in my office for about a half an hour to do it. By the time we get you set up, make sure that there's no wax in your ears, and then get you set up to do the screening. You watch the video, and then you take the test, and then we go over the results with you. It's about a half an hour process. If it's something that you're interested in, you can schedule online at columbinecares.com. I have an online scheduler, or you can call the office. I'll put my phone number up at the end. And it's also possible that your current audiologist might have a Cognivue in his or her office as well. So if you're interested in doing this, you might ask your current audiologist about taking this screening. The first program that I'm going to talk about is called CLEAR. And CLEAR is an auditory training program that was developed by Dr. Nancy Ty Murray at the Washington University School of Medicine. And this is a scientifically proven program. It consists of computerized games that train and develop listening skills and cognitive abilities. CLEAR can be purchased on a subscription basis for $24.99 per month. And there's the website that you can go to if you're interested in checking that out. LACE, or the Listening and Communication Enhancement Program, is another auditory training program. This one has been around for a long time. It was created by audiologists at the University of California, San Francisco. And this is also a computerized training program that has been shown to improve speech understanding in difficult listening situations. LACE has 4 types of exercises that go with it to help improve speech in noise, rapid speech, speech with competing speakers present, and word memory. And LACE is a one-time charge or fee of $99. BrainHQ is a program that is not just meant for people who have hearing difficulty. It's also designed for people with normal hearing, unlike the first 2 that I talked about. BrainHQ is something that can be purchased online. It consists of computerized games that exercise memory, attention, brain speed, people skills, intelligence, and navigation. BrainHQ is also a subscription of $14 per month. The Hearing Wellness Journey is a program that was developed by a friend and colleague of mine, Dr. Don Hyman, who has a practice in the Chicago area. And this is a video-based auditory rehab program that consists of 5 modules. She talks about understanding hearing loss, caring for your hearing aids, communication strategies, and listening exercises. And the Hearing Wellness Journey is just one charge of $60. And of course, I have to tell you about my program, which is the 5 Keys online communication training program. So you might be aware that I've had a book available for, 8 years now called Frustrated by Hearing Loss, 5 Keys to Communication Success. So that is still a tool that's available for anybody who has hearing loss and their family members. But I've recently created an online program to go along with it. And it basically is lessons that are delivered to you via email once per week for an entire year. So there are 53 lessons that give you bite-sized pieces of information and about communication strategies, hearing aid maintenance tips, and there's a troubleshooting guide. It gives information about technologies in addition to hearing aids that can help those who have difficulty hearing. There are games and activities embedded into the program and also links to other consumer organizations like the Hearing Loss Association of America. So this program is a one-time charge of $59, and you actually get the book, the handbook to go along with it. And that can be ordered at 5keys.info, or you can ask your audiologist about it because other audiologists do provide this program to their patients sometimes. I don't think there are any others in Colorado. Actually, there's one in Longmont that is providing it at this time. And that is the Longmont Hearing and Tinnitus Center with Dr. Deanne Redden. All my other customers are out of the state. So if you're in the state and you're wanting to order this, you'd want to go to the website and order it directly. And then finally, I want to give a giant kudos and a shout out to my new friend, Leslie Van Grove, who is on the call today. Her program, she talked to you all about it a couple of months ago, I believe, but Brain Empower is an in-depth holistic program that is taught by Leslie Van Grove, who is trained as a certified Alzheimer's Prevention and Research Foundation specialist, as well as a certified yoga instructor. And Brain Empower is currently offered live via Zoom through the Age Well Center in Boulder, but an on-demand online option may be coming soon. So I encourage you, if you haven't already, to join Leslie's email list so that you're kept up to date on when this might be available for the greater community. So remember that it is smart to have your cognitive performance screened early and often. Cognivue is a screening of cognitive performance. It is not a diagnostic test. The screening is not intended to determine if you will have or will be getting dementia or Alzheimer's disease. However, on average, individuals wait 5 to 10 years before pursuing treatment for hearing loss, and this can potentially contribute to cognitive decline. So it's something that we need to be doing and doing early. Driving brain health awareness and improving access to cognitive screenings are among the most important and urgent challenges of the 21st century. So thank you very much for allowing me to speak to you today, and I will open it up for any questions.